Differentiating Warm Diseases by the Qing Dynasty physician Wu Tang. Chapter 3, Middle Jiao section, sections 2 to 10. 2. In the case of Yangming warm diseases with a rapid and floating pulse, the primary treatment method is to use the modified bamboo leaf and gypsum decoction. A rapid pulse refers to a fast pulse rhythm, as if beating in a hurried and abrupt manner, indicating an urgent condition. Therefore, it is necessary to employ cold and pungent herbs to clear heat by venting exterior pathogenic factors, allowing for their expulsion from the body. The modified bamboo leaf and gypsum decoction is a prescription that combines cold and cooling herbs with sweet and cold herbs. Its ingredients include 5 qian, a unit of weight, of bamboo leaves, 8 qian of gypsum, 6 qian of ophiopogon root, and 3 qian of licorice. After boiling these materials, the decoction is divided into 3 portions, to be taken 3 times, typically within 3 hours. 3. In cases of Yangming warm diseases with prominent but not severe symptoms and without a floating or swelling pulse, it is appropriate to use the minor sinking qi decoction for a gentle adjustment. If the symptoms of Yangming warm diseases are noticeable but not overly severe, treatment is necessary to ensure they do not worsen. The minor sinking qi decoction can help harmonize stomach qi without the need for drugs like mengxiao, natri sulfurs. 4. When dealing with Yangming warm diseases, excessive sweating, a tongue coating turning yellow and dry, it is suitable to use the minor sinking qi decoction. If excessive sweating leads to the dispersion of body fluids and constipation, and the tongue coating becomes yellow and dry, then it's necessary to use the minor sinking qi decoction. 5. In the case of Yangming warm diseases with no sweating and obstructed urination, the initial treatment involves using Niuhuang ox gallstone pill. If there is still no bowel movement, then the warming the stomach and sinking qi decoction should be administered. When a patient with Yangming warm diseases lacks perspiration and experiences urinary obstruction, it may be due to incomplete formation of feces rather than constipation or dry stools. If the bowels remain unrelieved and sweating is absent, this signifies a blockage in both external and internal pathways, with pathogenic factors deeply entrenched in the lower abdomen. Therefore, it's necessary to employ mengxiao, natri sulfurs, a cold and salty substance, and Diahuang, rhubarb, along with gancao, licorice, which have bitter cold properties, instead of xingzao, Fructus liquidambaris. In cases of warm disease, the lack of bowel movement may be due to dry stool or pathogenic factors deeply affecting the heart and lungs. Therefore, careful observation and diagnosis by the physician are required to prevent incorrect treatment approaches. 6. In Yangming warm diseases, when the patient's face and eyes become notably red, extremities become extremely cold, even the whole body feels cold, with no nausea or vomiting but rather a state of mental confusion. The patient has not had a bowel movement for 7 to 8 days, presents with red-colored urine, a weak and sometimes barely detectable pulse, a distended and sometimes resistant abdomen, and a preference for drinking cold water. In such cases, the grand sinking qi decoction should be used for treatment. It is crucial to differentiate this condition to ensure that symptoms are extreme, akin to intense heat, rather than a mixed presentation of heat and cold symptoms, before applying the grand sinking qi decoction. Key indicators include red eyes, red urine, abdominal distension, and a preference for drinking cold water. 7. In cases of Yangming warm diseases with purely watery diarrhea and no passage of solid feces, termed heat closure with side stream, the treatment should involve using the warming the stomach and sinking qi decoction. In situations of heat closure with side stream, the issue is not one of airway blockage, and thus there is no need to use Shepa, Fructus aurantii immaturus. Mengxiao should be used separately to alleviate the heat closure. However, it is essential to remember to slowly administer gancao to mitigate the strong laxative effect of mengxiao, ensuring that it resolves the obstruction within the intestines. Otherwise, the heat closure will not be expelled, leading to diarrhea and potential harm to the body. The grand sinking qi decoction is not suitable for this condition. 8. In the case of Yangming warm diseases, if there is a blockage due to excessive heat along with hiccup symptoms, appropriate treatment measures should be taken. If hiccups persist, it indicates a problem in the middle jiao, whereas intermittent hiccups denote lower jiao conditions. The Jin Kue Yao Lu describes hiccups accompanied by abdominal distension. Observing the timing and characteristics of hiccups can help pinpoint the issue, and once the location of the blockage is determined, the treatment can be effective. For hiccup symptoms caused by excessive heat in the Yangming stage, the aim is to promote the smooth flow of qi. However, the severity of symptoms can be difficult to determine in advance, so only general bowel clearing measures are mentioned, and the specific herbs used may vary based on the actual presentation. Furthermore, hiccup symptoms in the middle jiao due to excessive heat will involve continuous and rapid hiccups because a significant accumulation of gastric qi forces lung qi to rise, resulting in the conflict causing hiccups. On the other hand, intermittent hiccups suggest lower jiao weakness as the underlying cause, making treatment more complicated, hence categorizing it as a lower jiao issue. 9. In cases of Yangming warm diseases with lower abdominal diarrhea and a strong and rapid or slippery pulse, the treatment involves using the minor sinking qi decoction. If the pulse is not strong, near 1 WAN, ox gallstone pill, or Zixuaden can be used for treatment. Lower abdominal diarrhea, as described by Kusha, is a condition of weak intestines and an overfilled stomach, necessitating the use of Da Huang, rhubarb, to stimulate the stomach, without the need for mengxiao, natrii sulfurs, to moisten and clear the intestines. The differentiation in this context regarding the pulse being strong or not aims to avoid misdiagnosing Yangming warm diseases as pericardial diseases and incorrectly using the sinking qi decoction. In such cases, aromatic opening therapies should be continued. The components of the minor sinking qi decoction are bitter and pungent, with relatively strong bowel-moving effects, including 5 qian of Da Huang, 2 qian of hopa, magnolia bark, and 1 qian of shisha, Fructus aurantii immaturus. After boiling these herbs, the decoction is divided into 3 portions, with the first portion taken initially, then further doses taken as needed after the evacuation of residual feces, if necessary. The ingredients of the warming the stomach and sinking qi decoction lean more towards cold properties to address internal damp heat conditions, including 3 qian of Da Huang, 5 qian of mengxiao, and 2 qian of shengangkao, raw licorice. 10. In cases of simultaneous urgent issues in the upper, middle, and lower jiaos, elevated body temperature, intense thirst, dry tongue, a non-floating but unusually rapid pulse, a golden yellow tongue, excessive phlegm, and when the sinking qi decoction alone is insufficient, the combination of the sinking qi decoction and the minor sinking qi decoction may be considered. The term simultaneous urgent issues implies that heat in the upper jiao has not been cleared, it has expanded into the middle jiao, resulting in high Yangming stage body temperature, unbearable thirst, an extraordinarily rapid pulse, dry tongue, and the consumption of kidney fluids due to excessive Yangming dry heat. If this is not resolved, it can lead to upper jiao residual pathogenic factors sinking in, potentially causing chest diseases. Hence, there is a need to use the combination of the minor sinking qi decoction and the sinking qi decoction to clear the pathogenic factors within all 3 jiaos in one go. This is because the condition is urgent, and the herbal formula must act swiftly. However, it must be used based on specific circumstances, and should not be administered arbitrarily. The ingredients of the combination include herbs that are bitter, pungent, and cold in nature, such as 5 qian of sheng Da Huang, 2 qian of hopa, 2 qian of shisha, 3 qian of banksia, Pinellia ternata, 3 qian of gualu, Fructus trichosanthus, and 2 qian of huanglian, Coptis chinensis. After boiling these herbs, the decoction is divided into 3 portions, with the first portion taken initially, and further doses taken as necessary once relief is obtained. To be continued.